Had your tooth removed and now the pain is getting worse instead of better? You might be facing a dry socket, one of the most painful dental issues after extraction. But don't worry, in this video, we'll break down everything you need to know, what it is, why it happens, how to identify it, and most importantly, how to treat and prevent it. So stay tuned. What is dry socket? After a tooth is extracted, whether it's a wisdom tooth, molar, or any other, the body begins its natural healing process. One of the first steps in this process is the formation of a blood clot in the empty socket where the tooth used to be. This clot plays a critical role. It protects the underlying bone, nerves, and tissues, while also providing a foundation for new tissue to grow and heal the area. Think of it as a natural bandage. But sometimes, things don't go as planned in some patients. This blood clot either fails to form at all, gets dislodged too early, or dissolves prematurely. When that happens, the bone and nerves inside the socket are left exposed to air, food, bacteria, and fluids. The result? An extremely painful condition known as dry socket, or medically, alveolar osteitis. This condition usually develops 2 to 4 days after the extraction, most commonly affects the lower molars, particularly the wisdom teeth, can be one of the most painful dental complications after an extraction. Unlike a normal healing socket where pain reduces gradually, dry socket pain often worsens after a few days, becomes throbbing, and can radiate to your ear, temple, or even neck. And the worst part, it delays. Healing increases the risk of infection and may require multiple visits to your dentist for treatment. Causes and risk factors. Now that you understand what a dry socket is, let's talk about why it happens and who is most at risk. Dry socket doesn't affect every patient after tooth removal. In fact, it only occurs in about 2% to 5% of cases, but the chances are significantly higher in certain situations. Let's explore the most common causes and risk factors in detail. Cigarette 1. Smoking and tobacco use. Smoking is one of the biggest risk factors for dry socket. The chemicals in tobacco reduce blood flow to the mouth, which slows healing. The suction force used while smoking can dislodge the blood clot. Even smokeless tobacco products like chewing tobacco can irritate the socket and delay healing. Back and index pointing. Right, dentists usually advise not to smoke for at least 48 to 72 hours after an extraction. Soap 2. Poor oral hygiene. If you don't keep your mouth clean, bacteria can invade the empty socket. This can lead to infection, delayed clotting, or breakdown of the existing clot. It's crucial to follow your dentist's post-op instructions, including gentle rinsing and avoiding touching the site. Cup with straw. 3. Drinking through a straw. Many people don't realize this, but using a straw creates a strong suction pressure. This pressure can literally pull the blood clot out of the socket. Even just a quick sip can disrupt the healing process. Light bulb tip: avoid straws for at least 1 week after tooth removal. Face with open mouth. Dashing away. 4. Spitting or rinsing forcefully immediately after surgery. Some patients try to spit out saliva or rinse their mouth aggressively. This force can loosen or wash away the clot. Instead, gently let saliva drool out and only rinse softly as advised by your dentist, usually starting 24 hours after extraction. Pill 5. Hormonal changes, especially in women, especially those on birth control pills, have a higher risk of developing dry socket. Estrogen can affect the healing process and interfere with clot formation. For this reason, some dentists prefer to schedule extractions during the lowest hormone days of the menstrual cycle. Gear 6. Complex or traumatic extractions. The more difficult the tooth removal, the higher the risk of dry socket. Impacted wisdom teeth or fractured teeth often require more surgical manipulation, which increases trauma to the area. This can make the healing process slower and the blood clot less stable. Chart increasing. 7. History of dry socket. If you've experienced dry socket in the past, you're more likely to get it again. Your dentist may take special precautions, such as placing a medicated dressing after the extraction to reduce your risk. Face with medical mask. 8. Certain medications, some medications like steroids, bisphosphonates, and blood thinners can interfere with healing and increase dry socket risk. Always tell your dentist about all the medications you're taking before the extraction. Dry socket is caused when the healing process is interrupted. Whether it's due to a physical action like sucking or spitting, or internal factors like hormones and poor blood flow, the goal is to protect the blood clot and support natural healing. Symptoms of dry socket. Recognizing a dry socket early is the key to avoiding prolonged pain and delayed healing. But how can you tell if what you're experiencing is normal post-extraction discomfort or something more serious? Let's break down the common signs and symptoms of dry socket in detail. Fire 1. Severe, throbbing pain that worsens over time. Unlike the normal discomfort that gradually decreases after a tooth extraction, dry socket pain typically begins 2 to 4 days after surgery, becomes intense, sharp, or throbbing, worsens with time rather than improving. This pain is often described as one of the worst dental pains a patient can experience. Stop sign, red flag. If your pain peaks several days after the procedure instead of getting better, you may have a dry socket. Brain 2. Radiating pain to ear, eye, temple, or a neck. Dry socket pain doesn't stay localized at IT, often spreads or radiates to the ear, the side of the head, or temple, the jaw, and even the neck, or throat, back and index pointing right. This radiating pain can feel like a deep nerve pain, making everyday tasks like talking, chewing, or even sleeping very difficult. I3. Visible empty socket. If you gently look at the extraction site in the mirror, a normal healing socket should look like a dark red clot covering the area, maybe some white or yellow patches, which are part of healing tissue. But with a dry socket, you might notice a visible hole, no clot, or very little tissue covering the area, exposed white bone at the bottom of the socket. Brain reminder: never poke the socket yourself. Use only a mirror and light if checking. Faced with medical mask. 4. Foul smell or bad breath. One of the first signs patients notice is a rotten or foul odor coming from the mouth. This happens because bacteria accumulate in the open socket. This can lead to halitosis, bad breath, unpleasant taste in the mouth. Even after brushing or rinsing, this symptom alone often drives patients to seek help, especially when accompanied by pain. Ice cube 5. Delayed healing. A normal extraction site starts to show signs of healing after 3 to 4 days. That if you notice no progress or worsening discomfort after several days, it might mean healing has been interrupted due to dry socket. Thermometer 6. Swelling, fever, or enlarged lymph nodes. Less common. In some cases, untreated dry sockets can become infected. Signs may include mild swelling around the jaw, low-grade fever, swollen lymph nodes under the jaw or neck. Stop sign important. These symptoms require immediate dental attention, as they could indicate an infection spreading beyond the socket. Pushpin quick symptom checklist. Let's summarize the main symptoms you should look out for. White heavy checkmark pain that starts 2 to 4 days after extraction. White heavy checkmark pain that gets worse. Instead of better, white heavy checkmark pain radiating to the ear, temple, or neck. White heavy checkmark empty socket with exposed bone. White heavy checkmark foul breath or bad taste. White heavy checkmark possible swelling or fever. Speaking head. If you suspect a dry socket, do not wait. The longer you delay treatment, the more painful it gets and the longer it takes to heal. How is dry socket treated? If you suspect you have a dry socket, the most important step is to visit your dentist or oral surgeon as soon as possible. This condition doesn't go away on its own easily. Unlike normal post-extraction discomfort, a dry socket requires professional care to reduce pain and restart the healing process. Let's break down what treatment looks like, step by step. Soap 1. Thorough cleaning of the socket. The first thing your dentist will do is gently flush the socket to remove food, debris, bacteria, dead tissue. This helps prevent infection and gives the socket a fresh environment to start healing again. Dentists may use saline, antiseptic solutions, or even hydrogen peroxide in some cases for this process. Brain important. Never try to rinse aggressively at home. Let your dentist handle this safely. Adhesive bandage 2. Medicated dressing or packing after cleaning. Your dentist will often apply a medicated dressing inside the socket. This dressing usually contains a soothing anesthetic like eugenol or clove oil, an antibiotic or anti-inflammatory materials to protect the exposed bone. This not only provides almost immediate pain relief, but also shields the nerve endings from air, fluids, and food. Light bulb note. The dressing may need to be changed every 1 to 3 days, depending on how quickly healing progresses. Pill 3. Pain management. Your dentist may prescribe or recommend pain medications. NSAIDs like ibuprofen for inflammation and general pain relieve stronger analgesics. If over-the-counter medications aren't effective in some cases, clove oil-based gels may be suggested for temporary home relief. Warning, warning. Never self-medicate with leftover antibiotics or painkillers. Syringe 4. Antibiotics if infection is present. Dry socket itself isn't always infected, but it can easily become infected if left untreated. If there are signs of infection, swelling, fever, pus, your dentist may prescribe a course of antibiotics. Suggest additional rinses like chlorhexidine mouthwash. Spiral Calendar 5. Follow-up visits. Managing dry socket is not a one-time fix. Your dentist might ask you to return every 1 to 2 days for dressing changes, for regular assessments to monitor healing. Once the pain subsides and the tissue begins to heal, dressings will no longer be needed. Brain your role. Continue to follow the aftercare instructions carefully and maintain oral hygiene. House 6. Home care during healing. Even after treatment begins, self-care at home is essential. Here's what your viewers should do. White heavy checkmark. Do. Rinse gently with warm salt water 2 to 3 times a day. After 24 hours, keep the rest of the mouth clean using a soft toothbrush. Take medications as prescribed. Stick to a soft food diet. Soups, yogurt, mashed potatoes. Drink plenty of water to stay hydrated. Crossmark. Don't smoke or use tobacco. Drink through a straw, touch, or poke the socket with fingers or tongue. Eat spicy, crunchy, or hot foods. Overexert yourself physically in the first few days. Man in lotus position. How long does it take to heal? With proper treatment and care, pain usually improves within 24 to 48 hours, and complete healing takes about 7 to 10 days. If left untreated, dry socket pain can persist for weeks and may even lead to complications like infection or delayed bone healing. So again, don't ignore it. How to prevent dry socket. The good news is that dry socket is preventable in most cases. B. Why taking the right precautions before and after a tooth extraction, you can drastically reduce your chances of developing this painful condition. Let's go over the most effective ways to prevent dry socket. No. Entry 1. Don't smoke or use tobacco products. Smoking is the #1 cause of dry socket. Tobacco chemicals reduce blood flow, slow down healing, and expose the clot to toxic substances. The suction motion used while inhaling can also dislodge the clot. Spiral Calendar. How long should you avoid smoking? Ideally, for at least 72 hours after surgery. Even better if you can avoid it for a full week. Light bulb tip. If quitting is difficult, talk to your dentist about nicotine patches or alternatives. Cup with straw 2. Avoid straws completely. Drinking from a straw creates negative pressure, suction, in your mouth, which can pull the blood clot out of the socket. Even small sips can be risky. White heavy checkmark solution. Drink directly from a cup or glass for the first 7 days after extraction. Face with open mouth, dashing away 3. Don't spit or rinse forcefully in the first 24 hours. Do not rinse, gargle, or spit forcefully. These actions create pressure that can disturb the fragile clot. White heavy checkmark instead. After 24 hours, rinse gently with lukewarm salt water 2 to 3 times a day, especially after meals. Soap 4. Maintain gentle but proper oral hygiene. Keeping the mouth clean is critical to prevent bacterial buildup around the socket. However, be careful around the extraction site. White heavy checkmark. Use a soft bristled toothbrush. White heavy checkmark. Avoid brushing directly on the extraction site for a few days. White heavy checkmark. Do not use alcohol-based mouthwashes unless advised by your dentist. Pot of food 5. Follow a soft diet. Stick to soft, cool, and smooth-textured foods for the first few days. Good options include yogurt mashed potato smoothies without a straw, scrambled egg soup, not too hot. Crossmark. Avoid crunchy chips, popcorn, nut spicy or hot food, sticky candies, or chewing gum. These can irritate or even get lodged in the socket. Pill 6. Take prescribed medications properly. If your dentist gives you antibiotics or painkillers, make sure to take them as instructed. Don't skip doses, even if you're feeling better. Some medications also help reduce inflammation and support proper healing. Woman in lotus position 7. Avoid heavy, physical activity strenuous workouts. Bending over or lifting heavy objects can increase blood pressure, which may lead to bleeding or dislodging of the clot. Take it easy for at least the first 48 to 72 hours. Clipboard 8. Follow dentist's post-op instructions closely. Every mouth is different. That's why it's critical to follow your dentist's personalized instructions. Attend all follow-up appointments. Contact your dentist. If anything feels abnormal, telephone receiver. When in doubt, call your dentist. Don't wait until the pain becomes unbearable. White heavy checkmark. Top tips to prevent dry socket. No smoking. Don't smoke or chew tobacco. Cup with straw. Avoid straws and suction. Don't rinse or spit forcefully. Soap. Keep your mouth gently clean. Pot of food. Eat soft foods for 3 to 5 days. Pill. Take medications as prescribed. Man in lotus position. Avoid heavy exercise. Clipboard always. Follow your dentist's instructions. When to call your dentist, call your dentist immediately. If the pain gets worse instead of better, pain radiates to your ear, neck, or head, you notice a foul odor or bad taste, you can see exposed bone swelling, fever, or pus occurs. Early treatment prevents complications and speeds up healing. Dry socket is painful but temporary and treatable if it's caused by the loss of the protective blood clot. Avoid smoking, straws, and heavy rinsing after extraction. Seek prompt dental care if you experience any warning signs. Your mouth deserves proper healing. Don't ignore the pain. Direct speech balloon. Have you or someone you know ever had a dry socket? Share your experience in the comments below. And if you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more dental tips from Mr. Teeth. Your smile matters. Beaming face with smiling eyes.